Nancy recently did a great video on urinary tract infections and antibiotics in the hospice care. Today, I'm going to talk more broadly about the role of antibiotics in hospice and help clear up a common misconception. There's a bit of a myth out there that once someone is on hospice, they can't get antibiotics. It's simply not true. If a hospice patient shows signs of infection like pain, discomfort, or distress, and antibiotics could help relieve those symptoms, then yes, the hospice doctor will often prescribe them. The goal always is comfort. Infections in hospice are fairly common. The ones we see most often are respiratory infections, urinary tract infections, and skin infections. But here's where it gets a little more complex. Hospice patients are in a natural stage of decline. Their body's energy, including the immune system, is slowly shutting down. Sometimes what looks like an infection may actually be the body's organs slowing down, part of the dying process, not something that antibiotics can fix. That's why we often take a thoughtful approach. If antibiotics will bring relief, especially if the patient is in pain or distress, then absolutely, we consider them. One of the first questions we ask is, can the patient swallow them safely? If they're barely taking in food or fluid, is adding medication, especially ones with possible side effects, really going to bring comfort? Some of the side effects of antibiotics include nausea and vomiting, diarrhea or abdominal cramping, and also there's interactions with pain meds or anti-anxiety medications. For someone whose system is already fragile, those side effects can be harder to tolerate than the infection itself. Families often ask for antibiotics when they suspect an infection is starting for the hospice patient, and that makes perfect sense. We are wired to want to fix things. But at the end of life, the goal shifts from fixing to comforting. So the conversation becomes, will antibiotics truly help this person feel better? Most hospice doctors are very willing and open to prescribe antibiotics when they can bring comfort, but they will also talk with you about the potential downside effects. It's not about withholding care, it's about choosing the kind of care that brings peace, relief, and dignity. So if you or a loved one is on hospice and showing signs of an infection, talk with your hospice nurse and doctor, ask the questions, explore the options together. It's not about saying no to care, it's about saying yes to comfort, even when that means letting go of certain treatments. At the end of life, understanding and compassionate care is what really matters most. And that starts with the open, honest conversations. You can get a copy of our booklet, The Hospice Care Plan, by clicking the link below.